Hi, I'm Dr. Lisa Gregory, owner of Pain Free Lexington here in Lexington. If you've been living with neuropathy, burning feet, numbness, tingling, balance issues, and you've been told there's nothing that can be done, you just have to manage it, I want to gently challenge that idea because neuropathy is not something you should have to simply live with for the rest of your life. There is a different way to approach this. In traditional medical care, the focus is often on symptom management, and symptom management has an important role. Medication can reduce pain, it can calm discomfort, it can make things more tolerable, but symptom management and healing are not the same thing. Managing symptoms does not automatically mean we've addressed why the nerves are damaged, why circulation is poor, why inflammation is high, why nerve signaling is disrupted. Those are two very different philosophies. One approach asks, how do we control this? The other asks, why is this happening? What and how do we restore function? At Pain Free Lexington, we focus on restoration. I've been in practice for over 28 years, and I will tell you something very honestly. I am passionate, truly obsessed with helping people resolve chronic health issues, not mask them, not manage them indefinitely, not just make them tolerable, but correct them. Because I have seen what happens when chronic conditions are only managed. People slowly adjust to a new normal. Higher medication doses, more side effects, more fatigue, more limitations, and somewhere along the way, they stop believing they can feel better. I don't accept that. You do not have to live the rest of your life dependent on medications just to function. There is a better way. Let's take type 2 diabetes as an example. Type 2 diabetes develops over time. It's driven by metabolic dysfunction, and in many cases, it can be dramatically improved, even reversed, when the body is given the right strategy. But if blood sugar is only managed over time, that damage affects the nerves. And that's when neuropathy shows up. Now we're managing blood sugar, managing nerve pain, managing sleep disruption, managing side effects. But what if we stepped back and asked, how do we create an environment where the body can repair? I want you to understand something very important. Neuropathy is often not the starting problem, it's the downstream consequence of metabolic dysfunction, especially type 2 diabetes, which means if we only treat the nerve pain, but we never correct the metabolic issue driving it, we're always playing defense. At Pain Free Lexington, we don't just focus on neuropathy, we also help patients reverse type 2 diabetes so the other chronic conditions never have the opportunity to manifest in the first place. Because when blood sugar is dysregulated for years, it doesn't just affect nerves, it affects blood vessels, kidneys, vision, heart health, cognitive clarity, energy levels. Neuropathy is often the warning sign, but it doesn't have to progress. When we correct insulin resistance, when we reduce systemic inflammation, when we improve circulation, when we create metabolic stability, the body begins repairing at a foundational level. That means instead of managing diabetes for the rest of your life, instead of adding medication after medication, instead of waiting for the next complication to appear, we change the trajectory entirely. I am deeply passionate about helping patients not only calm nerve pain, but prevent further decline by correcting the root metabolic dysfunction. Because when type 2 diabetes is properly addressed, neuropathy doesn't continue progressing. And when the metabolic environment improves, the nerves finally have the conditions they need to heal. This is not about managing disease. This is about restoring health at its core because your body was designed to heal. It just needs the right conditions. At Pain Free Lexington, we start differently. We don't begin with medication, we begin with clarity. We do a comprehensive neuropathy consultation and nerve assessment. We test sensation reflexes, balance circulation, inflammation patterns, nervous system function, sleep disruption, because neuropathy is not random. There is always a reason the nerves are not firing correctly. And once we understand that reason, we build a structured, phase based healing plan. Our neuropathy reversal program is comprehensive. First, we calm irritated nerves and reduce inflammation, so the constant burning begins to quiet. Then we improve circulation because nerves cannot regenerate without oxygen and nutrients. Then we activate and stimulate nerve pathways, helping the brain reconnect with the feet and hands. Then we retrain balance and stability, restoring confidence and preventing falls. We improve sleep. We regulate the nervous system. We rebuild trust in the body. We track progress by function, not just pain numbers. And over time, patients begin saying, "My feet feel warmer. I can sleep through the night. I don't have to stare at my feet when I walk. I feel like myself again." That's restoration. If you're watching this, you may be thinking, what if it's too late? What if my nerves are too far gone? What if I get my hopes up again? Those fears are real. Most of our patients felt the same way before walking through our doors. They had already tried medications, supplements, different providers, and they were emotionally exhausted. What they had not experienced was a structured, comprehensive nerve restoration strategy. Neuropathy doesn't just affect your feet, it affects your independence, it affects your confidence, it affects whether you travel, play with grandchildren, go on walks, stand in the kitchen comfortably, sleep through the night. Before I go any further, I want to introduce you to someone whose story still stays with me. This patient was bedridden for 2 full years. Yes, 2 years. He couldn't get out of bed on his own because of his neuropathy. Every single part of his life depended on his wife. She took care of the household, worked a full-time job, and managed 100% of his daily needs. They were both exhausted, physically and emotionally. After going through our program, he didn't suddenly become cured or return to life overnight, but something incredibly meaningful happened. He was able to get out of bed and walk with a walker. That meant independence, dignity, and a life that no longer revolved entirely around limitation. It gave his wife relief, and it gave him his sense of self back. What you're about to hear is their story. We have got Mr. Barry Price. He's been coming in for about what?
7 weeks.
7 weeks. And he is greatly improved. And his brother-in-law wants to tell how he's doing. Go ahead.
Yes, before he started coming here, there he was bedridden and couldn't do nothing, and now he help him to get up. There he can sit up for a long time, do his treatments and stuff. You can get him out in the car now, and he holds his balance a lot more. I wouldn't have never thought he would be doing this good, or if he'd be able to walk anymore.
So you've seen a lot of improvement.
Oh yes, a whole lot.
That's fantastic.
And he was like that for about 2 years before he became seeing you.
Wow. Wow, that's great.
Yep.
So happy to hear.
You're doing good work, honey.
Thank you,
Pat yourself on the back. You're doing good.
That's what we're here for. I also want to share another patient's story because it highlights a different but equally frightening side of neuropathy. When he came into our office, he had no feeling below his knees. His wife lived in constant fear because he was falling over and over again. One fall broke his leg, another fractured his skull. Every step he took felt like a risk. His legs were so severely swollen that he couldn't even wear pants comfortably. After going through our protocol, everything changed. His balance improved, the swelling reduced, the falls stopped. And perhaps most importantly, his wife no longer lives in fear when he's home alone. She doesn't worry every time he stands up or walks across a room. What they regained wasn't just physical stability, it was peace of mind. This is Mr. Larry Mosley. When he first came into the office, he could not feel his feet at all, had no feeling in his hands, some up his arms to his elbows, and he had severe swelling in his ankles and legs. Tell us how you're doing now.
I'm doing much better. I've got feeling in my feet now. I can feel my legs, my hands. I can sleep all night, and I've not fallen since I started this program.
And you had a pretty bad fall before.
Yeah, I was falling regularly.
Great.
But now that hopefully that's behind me, but I'd highly recommend this program to anybody that has neuropathy.
That's fantastic. Thank you so much, and we're so happy for you.
I'm happy too.
Fantastic. Our mission is simple. We want you to stop planning your life around your symptoms. We want you to feel steady, clear, hopeful, strong. You do not have to accept decline as inevitable. Let me be clear about something. Medication has a place in healthcare, but long term reliance without addressing root causes often leads to higher dosages, more side effects, mental fog, fatigue, and continued progression. Our goal is not to abruptly remove medications. Our goal is to create measurable improvements so that, in coordination with prescribing providers, reliance may decrease as healing increases. That's empowerment. That's a different philosophy. At Pain Free Lexington, we are not interested in making you a long term chronic patient. We are passionate and obsessed with helping you resolve the underlying issue because you deserve to feel your feet again, to walk without fear,